Welcome back to The Wellness Effect. Before we get going, hit the subscribe button so you don't miss out on any of our episodes. Last time we started discussing cardiovascular diseases, and in this episode, it's really all about prevention. Dr. Sharen Maharaj is an expert in cardiology. Welcome, Dr. Maharaj.
Thank you. Happy to be on the show.
So, how do we prevent cardiovascular diseases?
Well, what is important to note
Yes.
is that cardiovascular disease is quite prevalent globally. In fact, about 32% of all deaths in the world are from cardiovascular diseases each year. And the prevalence has been increasing. And that's also been noted to occur in South Africa. So the reason behind the increased prevalence are due to risk factors such as hypertension, diabetes, hyperlipidemia. These all make up the metabolic syndrome together with central adiposity or obesity. And there are other factors, hyperuricemia, insulin resistance. The other factors, of course, that contribute to cardiovascular disease is smoking, so
Yes.
tobacco smoking, and alcohol use.
Mm.
So we need to understand what are the causes and the risk factors in order to know how to prevent cardiovascular disease.
Sure.
There's two types of prevention. There's primary and secondary preventions.
Maybe let's talk through primary, starting off with exercise. So we've heard a lot about VO2 max and strength training. How many times in a week should I be exercising to ensure that I'm maintaining a healthy heart?
Well, I would say at least 3 hours a week. So you could have 3 days per week that you train, an hour each, or you could divide it into 30 minutes daily if you so wish.
Great.
And there's different types of training. There's aerobic training, strength training, the resistance training, as you've mentioned, and flexibility training. So that would be more like yoga
Sure.
and such exercises,
Yeah.
such muscle strengthening exercises.
Excellent. So it's 3 times a week, aerobic, some strength and flexibility. And how does a healthy diet play a role in preventing cardiovascular diseases?
Our diet is full of processed foods, high salt, high sugar intake, and high cholesterol intake. So we would need to look at these. We would have to reduce salt. We're meant to have less than 5 grams per day in our diet. And it also means when one cooks food, to not add too much of salt to it.
Sure.
And after the food is cooked, perhaps not to add salt further to it.
Is there a specific diet that is really good for the heart? So we've heard of pescatarian, we've heard of vegan diets, we've heard of meat or carnivorous diets. I am of the opinion of seafood diets where I see the food and I eat it. But what's the Mediterranean diet? What's the best diet to have a healthy heart?
Well, I would not ascribe to any such diet
Sure.
at this point in time. I would rather say have whole foods, whole grain foods, as well as fresh fruit and vegetables, nuts, and reduce on the processed food. I think that a lot of people in South Africa do not have access to nutritious food.
Correct.
And I think it's a socioeconomic problem. So the staple, as we know, is pap, which is a starch, and it plays a role in patient or persons developing obesity. And obesity is also increasing in prevalence in the country, and that is also associated with cardiovascular disease.
Mm.
So there's a study done by Shisano et al. In 2013 in Cape Town that showed that 40% of South African women are actually overweight and obese versus 11% in males.
Mm.
So there is a high prevalence in females.
And maybe speaking about weight, is there a healthy weight that you should try maintain to have a healthy heart?
So one should know their numbers, which means you should know your body mass index. And that is looking at your weight
Okay.
and your height. So a body mass index between 18.5 to 24.9 is normal. In that instance, for instance, a person who is 1.5 meters tall
Yes.
should weigh around 55 kilograms.
Okay.
Or if you're 1.6 meters tall, you should weigh around 60 kilograms.
Mm.
And 1.7 meters tall, around 70 kilograms.
Okay.
But one can calculate it using the body mass index to know where you should be in terms of ideal weight.
Mm. I like that because the BMI then gives you, if you're too high on the scale, where you need to get towards. Let's talk about alcohol. So, is there a limit towards alcohol? Are we saying that alcohol in totality can lead towards, cardiovascular diseases?
So alcohol in moderation actually has been shown to be beneficial
Okay.
for cardiovascular disease. However, it's the dose
Sure.
and the duration.
Yeah.
So if you've had more than 14 units per week, and especially if it's been under a binge, so less than 3 days, then you do have a higher risk for cardiovascular disease.
Okay. And we talk about units. Is that one glass or is a unit an entire bottle?
A unit would be one glass.
One glass. Okay.
Yes.
Amazing. So we're looking at 15 in a week, 15 to 40.
14, not exceeding 14. In
okay.
fact, females should actually have less than 7 units per week.
Okay.
And males are allowed less than 14 units per week.
Note to self. Noted. So let's talk about stress, because stress, if you've seen post-COVID, I've noted the number of people having heart attacks due to stress. How do you manage stress to prevent, cardiovascular disease?
Well, actually, exercise does assist with managing stress.
Mm.
And I think developing a support network within your family, with your friends, and if you need further advice or counseling, then one should seek help with a social worker or a psychologist just to assist with coping mechanisms. So, stress is also a risk factor for
Mm.
cardiovascular disease.
Now, let's say you've had a cardiovascular event, heart attack. How do you improve the quality of life post having that unfortunate event?
Yes, so it is a shock when it does occur to you. Um, and there, first of all, you will be managed for your heart attack, for instance, given the medication that's necessary. Perhaps the cardiologist will offer you angioplasty, stenting, or perhaps you'll need a bypass graft,
Mm.
and then referred on to the cardiothoracic surgeon for that. So those things will occur. But what is necessary, I feel, is cardiac rehabilitation, which is not as prevalent in our country as it should be. I know that there are some places in Cape Town that offer it. In Pretoria, I only know of one hospital that offers it, but perhaps there are others. I'm not too sure.
Mm.
But
And what is cardiac rehabilitation?
So it is a multidisciplinary approach to patients. It involves the dietitian
Sure.
to counsel around the diet. It involves the physiotherapist
Mm,
and possibly a biokineticist who will prescribe the exercise. And by prescribe, I mean that they may do an exercise stress test to see where the patient start to develop symptoms
mm,
and then can determine um, how much of exercise and the intensity of exercise that the patient may do
mm,
following such an event. So, a psychologist is necessary to assist the patient through that emotional event,
mm,
um, as well as a medical practitioner who then will um, need to counsel the patient on risk factor management if they have diabetes or hypertension or hyperlipidemia, and they shall prescribe the correct medication for it and ensure that there's optimized control
mm,
of blood pressure and glucose and cholesterol.
mm.
So, um, yes, it is a multidisciplinary approach, as I mentioned. Um, and in terms of the training, the exercise training, um, it is prescribed, as I've mentioned, there's 3 phases to it.
Sure.
So the first phase occurs as an inpatient. So as early as 3 days into your admission, um, after having a heart attack, for instance, then the physiotherapist can start training you with just a bit of walking, 3 to 5 minutes, and then increasing gradually up to 10 minutes of training. Um, and there's no resistance training at that point in time. That's
Mm,
reserved for being an outpatient. Phase 2 of cardiac rehabilitation is the outpatient service. And that again it's supervised by the medical staff. And it's the hourly sessions.
sure.
Um,
Check-ins. Yeah.
so 3 hourly sessions for the week, which then would equate to 36 sessions over 12 weeks. And that should be phase 2. However, some patients may continue for a longer period
Sure.
depending on their requirements. Phase 3 is then the home based care. So, what you have learned already in phase 1 and 2 of training, you continue
Implement.
at home.
Okay. I like that it's quite holistic for those who have had an unfortunate event and kind of puts them on a pathway towards improving their lifestyle. Maybe you touched on tobacco use. Um, should we be limiting it? Should we remove it completely to prevent cardiovascular disease?
It should be removed
Okay.
completely. Um, and it is difficult to stop
Hmm.
for smokers. It is an addiction. It is difficult to rewire the brain. However, there are some aids, such as nicotine gum and patches, nasal sprays. There's also, if those do not work, um, some medication that can be tried,
Sure.
such as bupropion, varenicline. These are nicotine receptor antagonists or partial agonists. So they reduce the craving for nicotine. Um, and there's been a lot of debate recently about vaping as well.
Yes.
So, according to the American Heart Association, though, as recent as 2022, it has been shown to increase cardiovascular disease
Oh,
as
wow.
well. So, um, as much as everyone thought that it was e-cigarettes with no tobacco exposure, but in fact, there may be other ingredients that are predisposing to cardiovascular disease as well. And in fact, in a shorter period of time as compared with tobacco itself.
My goodness. Thank you for pointing that out because I think the prevalent notion currently is that vaping is the alternative. the safe alternative.
Then I must also touch on passive smoking.
Mm.
So, in people who are, and children, sorry, so exposed to passive smoking, then they are also at 25 to 30% increased risk of cardiovascular disease just from secondhand smoke. That also includes hookah.
Wow. Is tobacco the most common issue when it comes to cardiovascular disease?
It is.
Okay.
Yes, it is.
So you've kind of given us a broad view around cardiac rehabilitation and almost the pathway it helps patients go through. But who should receive rehabilitation support?
That would include patients who've had a heart attack in the last 12 months, as well as any patient with coronary artery disease or chronic stable angina, which means chest pain that occurs with exertion but relieved by rest, for whom no surgical intervention is required immediately. Those patients who have had intervention, so who have had a coronary artery bypass graft or a percutaneous coronary intervention, which is the stent insertion.
Sure.
Or those who have had valvular heart disease with valve repair or replacement. Those patients who've had a pacemaker or an ICD inserted, which is an implantable cardioverter defibrillator.
Okay, thank you for
All
that.
right. And even the patients who've had a heart transplant.
Okay.
All right. And it's also recommended for patients with heart failure because it's shown to increase or improve their functional capacity and their quality of life as well.
Mm.
And patients with peripheral artery disease.
Amazing. So I think you've given us a broad view of the patients, but it sounds like it's individuals who've had some sort of cardiovascular event. And let's talk about checkups. So how many times in a year should we be going to our doctors to get our hearts checked?
Well, the prevalence of hypertension is increasing, as we have said, and it's occurring in younger and younger individuals. So, as well as diabetes, I would, there's really no set prescription for it.
Mm.
However, I do believe that perhaps a yearly check after the age of 25, but that is my opinion entirely. Just to ensure that your blood pressure is controlled, that your blood glucose is normal,
Okay.
fasting blood glucose that's normal, and that a total cholesterol is also normal. Early detection is key.
Sure. So in those, you mentioned one, your blood pressure, glucose level, and cholesterol levels.
Yes.
Yearly checkup on just those three elements are really good.
Yes.
Okay.
And then if you continue with the correct diet and exercise, and moderation of alcohol,
Yes.
cessation of smoking, you should be healthy enough.
Thank you, Dr. Maharaj, for sharing your expertise with us today.
Thank you for having me.
Remember to subscribe so you don't miss out. I'll see you next time on The Wellness Effect. BankMed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by BankMed, yours in good health.